Hello, my name is Jussi Merenmies. I'm a senior clinical lecturer in pediatrics at the University of Helsinki, Faculty of Medicine, and program director of the degree program in medicine. Assessment plays a crucial role in students' learning and studying. It provides a structured framework for evaluating students' understanding and mastery of the course material. In higher education, including medical education, there are several key functions of assessment. We know that regular assessment can motivate students to engage consistently with the course material and stay on track with their studies. Assessments provide students with feedback on their performance, helping them identify areas where they need to improve and reinforcing areas where they are doing well. Assessments also help teachers to measure the effectiveness of their teaching methods and observe how learning objectives are being met. Assessments hold students accountable for their learning and ensure that they are meeting the required standards. In addition, assessment guides students in their studying by highlighting important topics and concepts that need more focus. Among high-quality medical education programs around the world, there is a strong movement to follow strict standards for education. In terms of assessment, the standards require assessment to ensure that students acquire the necessary knowledge, skills, and professional behaviors. Standards require medical schools to demonstrate that their assessment methods are aligned with educational objectives and competencies. This ensures that graduates are competent and prepared for clinical practice. The standards also ask that the assessment is valid and measure what they are supposed to measure. They should be reliable and provide consistent results. Assessment should also be fair, unbiased, and equitable. To ensure that assessment is effective and meaningful, it must be aligned with the learning objectives of the course. This can be achieved through different strategies. Clearly defined objectives should be specific, measurable, achievable, and relevant. In 2023, our program created assessment policy that guided courses to make blueprints that map the learning objectives of the courses to specific assessment tasks. Blueprint ensures that all important learning objectives are covered and that the assessment is comprehensive. Many different assessment methods should be used. In medical education, these include multiple choice questions, short answer questions, sometimes essays, clinical skills assessment like objective standardized clinical assessment, also called OSCE, to evaluate different competencies and learning outcomes. All assessments should be regularly evaluated to ensure that they remain aligned with the evolving curriculum and learning objectives of the course. International quality standards in medical education require a clear alignment between learning objectives, teaching methods, and assessments. Many medical degree programs use curriculum mapping as a systematic approach to ensure that all aspects of educational program are integrated and aligned. In our program, we have used curriculum mapping now for several years. It has helped us to map all objectives of the courses with the national learning outcomes of graduating doctors that were created in 2020 in collaboration of all medical faculties in Finland. Continuous assessment means that students' performance is evaluated throughout the course, rather than relying solely on final exam. Its role in learning includes that it provides students with continuous feedback on their progress, which helps them to adjust their learning strategies to improve their performance. It allows to identify learning gaps and challenges early, allowing for timely interventions and support. It also keeps students engaged and motivated by regularly assessing their understanding and skills. It creates formative assessment tool that informs both students and teachers about the effectiveness of the teaching and learning process. In our recent assessment policy of the medical program, we have committed to substantially increase formative assessment and feedback. Feedback is an essential component of learning process, especially in medical education. Constructive feedback helps students become aware of their strengths and weaknesses, promoting self-reflection and self-directed learning. Feedback provides guidance on how to improve, offering practical suggestions and strategies for better performance. By identifying specific areas of weaknesses, feedback allows students to focus their efforts on areas that need improvement, leading to more efficient and effective learning. In the context of medical education, feedback also contributes to the development of professional behaviors and attitudes, which are crucial for future healthcare practitioners. International quality standards in medical education emphasize the importance of formative assessment in providing ongoing feedback to students. Feedback is essential for professional development of medical students. It helps them develop critical self-assessment skills, resilience, and growth mindset, which are important for lifelong learning and professional practice. Creating a culture of feedback within the medical school is crucial for maintaining high-quality education. This involves trained faculty to provide effective feedback, who is able to encourage students to seek and act on feedback. In summary, assessment in undergraduate medical education serves as a critical tool for guiding and enhancing student learning and providing feedback and ensuring alignment with learning objectives. Formative assessment and constructive feedback are integral for fostering a supportive and effective learning environment. I encourage students to seek constructive feedback and teachers to give it.